Hi, I am Lori Underwood, a VA accredited attorney working for Woods & Woods, a law firm that has represented thousands of veterans nationwide in their VA disability compensation claims. Today we are going to be discussing VA claims for chronic pain. Chronic pain is pain that lasts longer than 3 months. It can be anywhere in the body. It can be throbbing, shooting pain, burning, stabbing. All of those symptoms apply to chronic pain. Some more medically known causes of chronic pain can include injuries, which can result in further degeneration or arthritis, cancer, autoimmune diseases such as diabetes or lupus, which can also result in peripheral neuropathy or other associated diagnoses as well. But at times there is no diagnosis associated with the chronic pain, and it is unexplainable. More research is needed on medically unexplained chronic pain or chronic pain that is not associated with known diagnosis, although research does show that it affects veterans at a higher rate than their non-veteran counterparts. An article published by the National Institute of Health shows that veterans are 40% more likely to experience chronic pain than their non-veteran counterparts, and that affects veterans of all ages, the young and the older veterans. You may prove your chronic pain as directly related to your service, and this would be if you sustained that injury in service, there are clear records that you attended sick bay to treat the injury, and there is a clear documentation of when that pain and injury was an onset in service. That may result in a direct service connection. Service connection by aggravation persists when you had a pre-existing injury when you entered into service, and this was noted and documented when you entered into the military, but because of either overuse or exertion or just the general duties of your service, your condition worsened more rapidly than it would have by natural progression. And the records, your service treatment records, would indicate that you were receiving treatment for this, or you were struggling with pain that had been exacerbated by some aspect of your duty during service. And that would be strong evidence of aggravation of a medical condition that you had entering into service. Service connection by aggravation can be hard, a little tricky to prove, so it does help to have a medical doctor who is trained to look at your medical records and be able to explain how they demonstrate that the condition worsened over time outside of its natural progression. Check out the links below for more information on aggravation and nexus letters. It seems most often chronic pain is not diagnosed until after service. Some of the injuries that you sustain during service that are service-connected may further progress over time as well and eventually lead to chronic pain that you did not experience at the outset of your service. And over time, that pain has become debilitating. You may attribute that to just your aging body, but it may also be aging at a pace more rapidly than you feel like it should be, and that is related to some of the diagnosis that you're receiving service connection for. You may also be service connected for conditions that we mentioned before, such as diabetes, which are autoimmune, but lead to conditions such as peripheral neuropathy, which bring about a new onset of pain. Chronic pain has been commonly linked with Gulf War service, and these are undiagnosed chronic illnesses. The term that the VA likes to use is medically unexplained multi-symptom chronic illness, and this is where there's no known associated diagnosis to explain the chronic pain. A medically unexplained multi-symptom chronic illness is a presumptive condition to Southwest Asia service, and you can see the links below. We have more information on those types of presumptives. The VA does not have a specific diagnostic code for chronic pain. If your chronic pain is unexplained and unassociated with a diagnosed condition, then they will rate on what is the analogous condition, meaning they will rate it based on the body part affected and rate it as closely as they can to establish the functional loss that you're experiencing due to the chronic pain. For example, if you have back pain and no diagnosis to explain the back pain, but you're experiencing functional loss, then they will rate you as closely as they can from the diagnostic code that best represents the functional loss you're experiencing in your back. Chronic pain can prevent a veteran from being able to work, and that may be reason for the veteran to pursue the total disability individual unemployability benefit through the VA, which is allowed for veterans who can't work due to their service-connected conditions. The combined effects of chronic pain may make even sedentary work impossible. You often have associated symptoms of difficulty sleeping, insomnia, trouble concentrating. Chronic pain may make finding a comfortable position to work in impossible, difficulty lifting, bending, carrying things. It can result in mental health symptoms as well, either onset of mental health or worsening. The pain is an awful lot for someone to deal with, so it can bring about mental health concerns, which bring their own limitations into the workplace as well. And there are also a whole lot of symptoms that come along with the medications that are prescribed for chronic pain, resulting in brain fog or inability to concentrate or sleepiness, which make work impossible as well. Those side effects of those medications for your service-connected conditions should be taken into consideration on your ability to work. A high-quality nexus letter may be crucial in proving your service connection for chronic pain or how it impacts your ability to work. We work with highly trained medical professionals who are accustomed to working with veterans and their medical records and understand their issues and are able to provide this evidence for our clients. We also work with vocational experts who are trained at explaining how your limitations impact your ability to obtain and maintain work in the national workplace, which is evidence that is needed to obtain the TDIU benefit. See the links below for our content on further explanation of the TDIU benefit. At Woods & Woods, we have worked on thousands of cases for our veterans over the years, and we work hard to get the veterans the benefits that they deserve. You can learn more about VA benefits by seeing the links below. You can also visit our YouTube channel for more information about VA benefits in general. If you would like help with your claim, you can contact us by clicking on the link below or giving us a call for a free consultation regarding your claims.